Have you ever tried radiofrequency ablation, or RFA, to help treat your chronic neck or back pain? It's a powerful tool, but as our next guest can tell you, it can become less and less effective. Dr. Mashuri and Dr. Church from Arizona Pain are here. Dr. Mashuri, with RFAs, are you burning nerves?
Yeah, I know, it sounds really archaic, but yes, that is the process, and it's something that we thought, as physicians, that we would do years ago. This has been at least 40, 50 years old technology, and yeah, it works. But the problem is that when you burn those nerves, they cease to conduct signals, but they also get damaged in the process. And as they get damaged, and as your body tries to heal that nerve, then the process restarts. But now sometimes it's even worse, because now you get scar tissue in the area, and so the problem continues to get worse over time. And it doesn't seem to last as long either. So the pain relief you get from the radiofrequency ablation becomes, it becomes less and less effective over time. That's why newer technology like this peripheral nerve stimulation therapy is really the new thing that makes it possible for patients to have significant relief. And the best thing about it is that, number one, it's covered by insurance, which is fantastic. But number two, it's just like the newer technology, just like your iPhone that gets an operating system update every once in a while, right? This technology can also be updated without you having to do anything. So as your symptoms change, as your pain changes, we can update the software, essentially, to make it more effective for you.
And how does a peripheral stimulator work?
Well, nerves, when they get damaged, they can cause pain. They can cause burning, numbness. And nerves are like electrical signals that send signals to the brain. But when the nerves are damaged, they'll send abnormal signals to the brain. Kind of like the old TVs with the rabbit ears. If the rabbit ears were, moved a little bit, or they were damaged, what do we see on the TV? We saw static. So when your nerves are damaged, they're sending static to your brain. So what we want to do is we want to decrease the static to your brain, so your brain doesn't see the static and you get relief from that.
And technology is so important in today's time and beneficial to help so many lives advance. What type of technology do you guys use at your practice?
Well, we work with many different companies and vendors. One company that we like to use in particular is called Nalu. And what we like about them is that they have done a significant amount of research and advancements in the field of peripheral nerve stimulation, where they've been able to reduce the size of the stimulator that is used significantly, where it's essentially as big as my thumbnail. And really how it works is that it really calms down those nerve signals that are being conducted through the spine, and provides relief that lasts for decades. And so as a result, patients can, after a very short treatment that lasts, let's say 10-15 minutes for the procedure, they can experience long-lasting relief where they don't have to keep going back and have another radiofrequency ablation and another. So those are just some of the things that are available right now.
And how do you know that this might be a good treatment or an option for you?
Well, if you suffer from chronic pain in your back, your neck, your knees, shoulders, hips, these are the options that we have been able to help patients with.
Dr. Mashuri and Dr. Church, thank you so much.
Thank you.
Thank you.
If you guys would like to learn more information about Arizona Pain, you can go to their website or call the number you see on your screen.